Welcome to the Ramadan Health Awareness Campaign Health Screening Training. We hope to provide you with a comprehensive overview of the logistics of running a health screening event at your centre. What we will cover. We will begin by looking at the aims of a health screening event, stations that can be held, and run through one way of setting this up. We will then talk about how to source and utilise equipment and health material, and how best to place your volunteers to ensure an efficient screening day. Data collection is an important aspect of these events, and we will address how the Ramadan Health Awareness Campaign collects, stores and uses anonymous data from screening events. To conclude, we will discuss photos, feedback forms, certificates, and some tasks to be completed post-event. Aims of health screening. The health screening event has three main aims. 1. To provide a platform for discussion of health issues. 2. To identify common health issues in the community. And 3. To signpost community members to further healthcare resources depending on individual needs identified at one or more of the screening stations. To summarise, health screening is intended as a springboard to identify and address both individual and community health problems. Screening stations. The screening stations can be divided into three sections: administration, general screening, and social and healthcare professionals. However, the way in which you set these up is down to you. Additionally, you will need to look at the resources and volunteers available to you. If there is a station that you are particularly interested in holding, but do not have an allocated volunteer, for example nutrition desk, please contact your named supervisor, who will be able to pass you details of past volunteers. Additional stations by social and healthcare professionals are a valuable aspect of the screening event, as healthcare professionals can discuss and interpret any test results and numbers, provide advice, and signpost to appropriate sources of information. These can include a GP consultation, pharmacist-led medication review, and optical and dental checks. Previous screening events have also benefited from a dietitian, physiotherapist, occupational therapist, osteopath, audiologist, counsellors, and mental health professionals. Stations and setup. In the following slides, we will go through some ideas for screening setup that have been used at past events. However, this is just one idea, and ultimately the setup will be down to you and your team, the space and resources you have available, and the number of attendees you are expecting. We would recommend you sketch a floor plan of where you intend different desks and stations to be, and the flow of people around the stations. This will ensure the event is safe and effective, and that you and your team are equally aware of the logistics. It is best to arrive at your venue 2 to 3 hours beforehand with a few volunteers to set up the stations and make sure that equipment is in working order. You should then aim to gather the rest of your volunteers for a briefing at least 30 minutes before the event begins, so that everyone is aware of how the event will run, can answer questions, and direct attendees to the correct area. This is also an ideal opportunity to take a volunteer group picture. You may want to consider holding a parallel screening event for ladies and gents. If this is the case, ensure you have enough floor space, equipment, and volunteers. It is useful to allocate floating volunteers to direct the flow of attendees around the stations, to answer questions, and to ensure the event runs smoothly. It may also be a good idea to place waiting chairs throughout your space, as there may be times when the desks become busy. Registration and data collection. A registration desk situated near the entrance is key to the event. Attendees can pick up screening forms and be given a brief overview of the setup. A volunteer should direct patient 1 to the registration desk to complete the registration form. Data collection will be discussed later on in this presentation. However, we would like to emphasise that data collection is vital to the continuing success of the RHAC campaign. Anonymised data will be collated and analysed to identify the health issues common to each community. The registration, data collection, and feedback stations can be situated next to each other at the entrance of your event. it is important that you have laptops available and an allocated volunteer for each of these 3 tasks. A volunteer should then direct patient 1 to the BMI desk and patient 2 to the registration desk. BMI, or Body Mass Index. BMI is a measure of body fat based on a person's height and weight. It can be a useful indicator for predicting risk of several conditions, such as type 2 diabetes or heart disease. You will need a calculator, a pair of weighing scales, and a measuring stick or height measure. This does not have to be costly. You can find a height measure online and print it out. To record a person's height, follow the steps on the slide. Ensure the surface is level and the person's head is straight, chin level and hair flat. Also ensure the person is standing up straight and not slouching. To record a person's weight, ensure they have removed their shoes and any heavy outer clothing such as a coat. BMI is calculated using the equation on the screen. Divide the person's weight in kilograms by their height in meters squared. It may be useful to have this equation printed out at the station for your volunteers to refer to. If the first few screening stations are occupied, a volunteer can direct patient 3 to the waiting area. Registration forms can also be filled out here while attendees are seated. Blood pressure. A volunteer should continue to direct people around the different stations to ensure the flow of attendees around the screening event. Watch the animation to see this in action. When taking blood pressure measurements, instruct your volunteers to take at least 2 readings. These can be recorded on the patient's screening form for discussion during their GP consultation. It is best to use automated blood pressure machines. Ideally, the blood pressure reading should be taken directly on the patient's arm and not through clothing or thick sleeves. If the patient needs to roll up their sleeve, ensure it is not tight or restricting blood flow in the arm, as this can affect the reading. Diabetes and cardiovascular risk. Blood sugar and cholesterol are both optional measurements. This will be dependent on the resources available to you. If they are non-clinical, the volunteers for the station will also need some training. The Diabetes Risk Score is a tool that can be found on the Diabetes UK website. It uses body measurements and other parameters such as ethnicity to predict a person's risk of developing diabetes. If you do not have the equipment available to perform blood glucose tests, using the Diabetes Risk Score is an effective and validated tool which can be used instead of or alongside blood glucose measurements. If you are unable to carry out cholesterol testing, all patients can have a Q-risk score calculated. The cardiovascular risk, or Q-risk score, is a validated scoring system used to assess a person's risk of having a heart attack or stroke over the next 10 years. The Q-risk score can be found online on the website shown on your screen. A volunteer with a laptop should ask the patient each of these questions in turn, and the online calculator will generate a score. This score should be recorded on the patient's screening form for discussion at the GP station. Colorectal and breast cancer risk assessment. We would suggest you dedicate 1 volunteer to this station. However, it can also be combined with the diabetes and cardiovascular risk station if this is more convenient. The screening form will have risk assessment questions. The volunteer simply needs to read the question out to the patient and note down the answers on the patient's screening form for discussion at the GP station. The colorectal question applies to both male and female patients aged between 60 to 74 years. They should be asked, have you been asked to give a stool sample in a blue specimen bottle in the last 2 years? If no, they should be signposted to their community GP to arrange this. The breast cancer screening question applies to female patients aged 50 to 70. They should be asked, have you had a mammogram test in the last 3 years? If they answer no, they should be directed to their community GP to arrange this. If the patient is younger than 50 or older than 70, they should be advised to check for lumps. Those over 70 years can also request mammograms via their community GP. Pharmacy. A volunteer should direct patient 1 to the pharmacy desk. When advertising your screening event, ask attendees to bring the medication list with them. This will ensure pharmacy medicines use reviews can be used productively to discuss and advise accordingly on patients' medicines. A volunteer should then direct patient 1 to the GP station. The aim of the station is not necessarily to diagnose and solve problems. Rather, it is intended to explore and address the patient's health concerns and signpost them to other services that may be useful. Generally speaking, patients should also be advised to see their own GPs in the community, particularly where medication may need prescribing. Ideally, the GP station should be placed after the pharmacy station, so that time can be used effectively to discuss health concerns with the GP, as medication-related concerns will have already been addressed at the pharmacy station. GP consultations may take some time. It is advisable to direct attendees to other healthcare professional desks at this stage, so that they are not sitting in the waiting area for too long. The final stations should be the feedback and data collection desk. More details of these areas will follow this animation. The health check is now complete. Equipment and health material. Once you have decided which stations you will set up at your screening event, make a list of any equipment and health material you may need. Where possible, you should ask volunteers to bring their own equipment, such as disposable mirrors for dentists or weighing scales for the BMI station. If you are unable to source equipment, please liaise with your named supervisor for further suggestions. The Central Health Team has ongoing relations with some national organisations and can arrange for some material to be delivered directly to your centre. You can also contact local health and social care organisations, charities and hospices to either provide you with leaflets and information booklets or to attend your screening and run a stall or station. The possibilities are endless and can be tailored to suit your community's needs. Volunteers. Liaise with your named supervisor when looking for volunteers. We have details of last year's volunteers and can pass contacts to you as a starting point. Social media invites and posters are a great way to generate interest. You could also use texts or word of mouth to publicise your event and need for volunteers. We would suggest contacting healthcare professionals directly, especially if you'd like to run a particular station, for example, a dietitian or nutrition desk. External organisations and charities may also be interested in holding a stall at your event. A great tip is to ask volunteers to come 30 minutes to an hour before your event starts, so you can have a team briefing. You could also ask some volunteers to come earlier than this to help you set up the stations and equipment. Data collection and photos. One of the key aims of holding health screening events is to identify specific health-related issues within our communities. These will enable us to manage our resources to target future campaigns, events, and health initiatives to tackle these issues. Data can be collected in one of two ways. The most straightforward method is through filling out information on a Google form. The link for this will be shared with you following this presentation. As the Google form is live online, you will require an internet connection. But this does not necessarily need to be a computer. The form can be viewed and used via mobile phone or tablet device. If you do not have internet access, a spreadsheet with the same fields can be downloaded from the Health Team's Google Drive, and this can be filled in on a laptop and uploaded onto Google Drive following your event. We would like to emphasize that all information must be treated in the strictest of confidence. The data collection, whether by Google form or spreadsheet, is entirely anonymous, and as such, any patient identifiable details such as name, date of birth or address are not included. It is advisable to allocate 1 or 2 of your volunteers for the task of data collection, depending on how busy you expect your event to be, as well as whether you can plan to hold a separate screening for ladies and gents. Photos. We would also encourage you to take as many photographs as possible during the event. These can be shared on social media to publicise the campaign, shared with your named supervisor via WhatsApp, and should also be uploaded to your centre's Google Drive so they can be included in our annual report. Please do ask permission of any attendees and volunteers before taking and uploading photographs. Post-event. Following your health screening event, there are several important tasks to be completed. We would recommend you make a stock list of all equipment, such as blood pressure monitors, as well as disposable items, such as gloves and glucose test strips. This inventory will be extremely helpful for future events. If you are unsure of where to store these items, please contact your named supervisor, who can advise you accordingly. It is important to send a message of gratitude to recognise your volunteers and collaborating organisations' efforts. There are templates available for this on the Google Drive, which you can tailor to your centre. Additionally, we will provide personalised certificates for all volunteers. Details for this will be discussed shortly. Feedback is extremely valuable to us, as it helps us to improve future events and campaigns. Formal feedback will be discussed on the next slide. However, we would also request that you have a debrief session on the phone with your named supervisor to discuss what you felt went well and what could be improved. This could include thoughts on your work, our supervision, working with your centres and volunteers, training such as this video, and any ideas you have for further work. Feedback and certificates. Feedback is essential to improving the Ramadan Health Awareness campaign. It's useful to know what went well and what could have gone better. We will provide links to 2 Google forms, one for volunteers and another for attendees. We would strongly recommend you ask attendees to fill out their feedback forms at the final data entry station while you are entering their health data onto the RHAC database. It is advisable to print out paper feedback forms for attendees to fill, particularly if you do not have many laptops available on the day. The RHAC team provide a certificate of participation for all volunteers. We ask that each volunteer fill out a Google form with feedback, regardless of which aspect of the campaign they took part in, as we value the thoughts of those working on the ground to deliver the campaign. Following this, we request that you, as centre representatives, send us a list of volunteers from all events at your centre, so that we can produce a personalised certificate for you to email out. Thank you for listening. If you have any questions, queries or comments, please do not hesitate to get in touch. You can email the MSc Health team on ramadhanhac@gmail.com. We wish you all the best with your health campaigns and look forward to working with you.